This program, while curated to help you improve your health, contains general advice and should not replace the individual advice of your medical practitioner.
I've seen the evolution of malfunction of the female body. We want to be proactive and educate women that they have to think about all of these systems from an early age because you're building your future. When people fast through breakfast, they're harming themselves. The body was evolved to receive food in the morning. I think the biggest threat is our modern society that's putting too much on women. And you just have to learn how to say no and then have to say yes to yourself and your personal needs.
In life, it's normal to have ups and downs. But what do we do when we get stuck? I've always been fascinated by the healing journey. Why do some people get better while others fail to make the shift? Welcome to the Season 2 Expert Series, where you'll meet 24 of the world's leaders in health discussing their passions and what it takes to make a shift.
We tend to be our harshest critics.
We are more than the muscle and bones in our body.
Whoa, that's so opposite of what I was taught growing up.
I would like a call to arms for women to know that their intuition isn't lying to them.
I'm Catherine Maslin, and this is The Shift. Hi, I'm Catherine Maslin, naturopath, author, and host of The Shift. In the Expert Series, we share the insight, stories, and expertise of each of our amazing experts. We're talking doctors, authors, naturopaths, researchers, and thought leaders. You may have heard them on Season 2 of The Shift, where we took snippets of these interviews to put them together in the series for you. If you haven't listened to Season 2 yet, I'd highly recommend checking out Episode 1, which will give you an overview of what constitutes women's hormonal health and a sneak peek into the series. We'll provide a link in the show notes. Dr. Felice Gersh is a multi-award-winning physician with dual board certifications as an OB-GYN and in Integrative Medicine. She is the founder and director of the Integrative Medical Group of Irvine, which provides comprehensive healthcare for women by combining the best evidence-based therapies from conventional naturopathic and holistic medicine. An active part of the PCOS community, Dr. Gersh works with the PCOS Awareness Association and is a member of the PCOS Challenge Medical and Scientific Advisory Board. She is the best-selling author of PCOS SOS and the PCOS SOS Fertility Fast Track. She is a prolific lecturer and has been featured in several films and documentary series and is a sought-after medical forensic expert, having worked on numerous high-profile legal cases. Needless to say, Dr. Felice Gersh knows her stuff. Let's get right into the episode. Dr. Felice Gersh, thank you so much for joining me.
Oh, it's my pleasure. I'm so happy that we get to talk again.
Would you mind just introducing yourself and telling us a little bit about who you are and what you do?
Absolutely. So I am sort of a rare breed. I am an integrative gynecologist. So I am board certified both in integrative medicine, which is a new branch of medicine, which should be what all medicine should be, of course, and OB-GYN. So I'm board certified in both. I spent the bulk of my career up until about 12 years ago doing thousands of deliveries and loads of surgeries. I taught surgery at USC to the residents. And then, like about 12 years ago, it was my time for my shift, okay? So I had to give up obstetrics. It was really making me ill. I didn't get sleep. I went night after night with phone calls or running into the hospital. I was such an old-fashioned doctor. I really wanted to be there for my patients. I knew that if I was having a baby, I'd want my doctor there. And so I did everything I could to be there for every patient who had a baby, and it really did me in, basically. So I gave it up, and then I probably had more sleep, I had more free time, and I started looking at my therapeutic toolbox for how I could treat my gynecological patients. And it was really sad, and it was eye-opening, because what I did was I actually had time, and for the first time in my career, I asked every single pharmaceutical rep who came to my practice, and there were many, many that came to my office in those days. And I said, show me the studies that got your drug FDA approved. I want to see exactly what you went through and what it showed. And then I was shocked as I actually looked at the data, and I saw how little the placebo really was from the drug itself. In fact, I looked at one of the drugs that was approved for use for overactive bladder, and it turned out that when you use the drug, statistically, you would go to the bathroom one less time over 24 hours. but they felt that was statistically significant. And it was like, oh my gosh, this drug can give you dementia and constipation and dry eyes and dry mouth. This doesn't make any sense to me for one less trip to the bathroom. So I had to do something because I felt the pharmaceuticals I offered were not really ideal. At best, they covered up a symptom. It wasn't really getting to the underlying reason for the problem. And it seemed in gynecology, every solution was either a birth control pill or surgery. And I just had to do more. So I went on my own personal journey. I started taking courses with naturopathic doctors and functional medicine courses. And I was pretty lost. I didn't really have an itinerary for what my journey was supposed to be. But at one of my conferences that I was attending, it was actually a naturopathic conference up in Portland, Oregon. There was one other medical doctor, MD, in the room. And I went up to her and I said, Dr. Lowdog, you and I are the only two MDs in this entire room of naturopathic doctors, and I'm really lost. I really don't know what to do. I'm trying to find ways to help my patients. And she said, after talking to me, I know you're qualified. I want you to think about coming to the fellowship in integrative medicine at the University of Arizona School of Medicine. In fact, the next class starts in 2 weeks. So that's what I decided to do. I went home. I flew home from Portland. I filled out the application that night. 2 weeks later, I was in Tucson. I did the 2-year fellowship in integrative medicine, which I completed in 2012, and I've never looked back. So now I have a much expanded therapeutic toolbox so I can help my patients, every one of them, to optimize their health. And in addition, I started doing lots more research on my own, taking additional courses to become expert in what I felt was really important, the total body of a woman, because every organ interacts with every other organ. So I had to understand how all of these organs fit together for the success of reproduction and ultimately the success of the health of the woman.
Tell me more about that holistic approach, how all of the organs are working together versus that reductionist approach that you were perhaps taught in medicine when you first got started.
It's really curious how the conventional medical world has broken the body into all these different organs. And of course, there's not this organ working in isolation from another. So looking at the whole body, I actually started in really the same approach that Ayurvedic medicine, Chinese medicine. I started looking at the gut. And then by understanding how the GI tract, how it worked and how it linked to the immune system, how it interplayed with the circadian rhythm and the hormones of the body, it really helped me to tie the whole body together. And I could see how the immune system, how it acted as sort of an information system, that it wasn't just about inflammation, that it was really how all the organs communicated. And then, of course, it expanded to the ovaries. If you have inflammation in the whole body, the ovaries become inflamed, and then it doesn't work as well, and you're going to lower fertility, and you're going to lower your production of hormones in the way they normally should be produced. So when you have problems with your gut or your brain, all of those things interact in a bidirectional way, and it gets, of course, more expanded. So the ovaries interlink. And then once you have hormonal dysfunction, hormones are the messengers of the body. They're telling all the different organs what to do. And if you don't have the proper hormones, and not just that you have hormones, they have to be produced with the right rhythms. So now we know everything is rhythmic in the body. And estrogen is what it turns out for a woman is really what I'll call the hormonal glue that actually links all the organs in the body together to create metabolic harmony for the purpose of reproductive success. And of course, whenever you have abnormal amounts of estrogen or you're not metabolizing it properly, so maybe you have too much or you have too little, for example, you're in menopause, you're not making any from your ovaries. So it turns out that hormones, when you really start understanding them, it helps to understand the whole body. And it changed my whole understanding of what the female body is really focused on. Because you'd think I would know, but it really took all of my studies to really hit me on the head with what it's all about.
How long have you been practicing for, Felice?
Well, it's been a long time. It's been over 3 decades.
How do you see the incidence of women's health problems over these last 3 decades? Have they increased, decreased? What are you seeing?
I'm seeing an escalation of problems for women. I've seen the evolution of malfunction of the female body. So if we start with the young ones, they're going through puberty. Okay, so they're, we'll say 12 years old. They have their first period. And then maybe 3 months later, they have another one. And oh my gosh, this period is horrendous. It's really heavy and painful. And then the next one comes and it's even worse. It lasts for a week and a half and the pain is terrible. The kid is taken out of school and then they hobble along. The mom is giving her, ibuprofen and such. And then finally, the mom takes her to the pediatrician and says, she's been having periods for a year and a half and she's now, almost 14 and this is miserable. And so what do? They put her on birth control pills. So she's like still 13 years old and she's on birth control pills. I'm seeing this rampantly. What is not being understood is that the menstrual cycle for a young female, any female at any age who's reproductive age, the menstrual cycle is a vital sign of female well-being. When the menstrual cycle isn't right, meaning it's irregular, it's really heavy, it's painful, or other symptoms like PMS are occurring, when the menstrual cycle is abnormal in any way, it means there's something wrong with that woman. Something is really wrong. So you have to get to the understanding. You have to be a detective and find out what is wrong. Very often it's nutrient deficiencies, actually. That's rampant now. They're deficient in all their antioxidants and magnesium and so on. So instead of addressing the real problem, they're trying to cover it up, like sweep it under the rug by giving something that takes away their natural hormones, their natural rhythms, without any understanding that these years, the teen years and the years in the 20s, are really foundational years for development of women. Their bodies are still evolving. The vagina is still evolving. The bladder is evolving. The brain isn't completed until over 25, 26 years of age. And the musculoskeletal system, which is a critical part of life and health, is not fully developed until a woman is close to 30, in that range, around 30. And if you have a woman on birth control pills through her teen years and her 20s, which is what is happening rampantly now, she will never optimally develop her musculoskeletal system. That means develop adequate amounts of bone, healthy ligaments and tendons, and adequate amounts of muscle. And as I said, these organs are not just for structure and function of movement, which are really critically important, but they're also endocrine organs. So hormonal problems are really humongous in this young group. When I started practice, it was uncommon, not unheard of, but uncommon that such high percentages of young girls have terrible menstrual cycles. Their hormones are not functioning properly, and they have irregular cycles, they're not ovulating well, and they're having all these cramps, and this really needs to be addressed. When we get a little bit older, like fertility is on the downside. Male and female both are having problems. Now, I can tell you in the area where I live, there are IVF clinics everywhere because so many women are having fertility problems. Now, they usually say, well, because women are delaying childbirth, and that is certainly part of the issue. But you have to recognize that these are women also who were often put on birth control pills when they were very young teens, and then now when they're like 30 or so, they're deciding they want to have kids, and they were never right to begin with. They had problems when they first started out in puberty. And so they've never really developed into healthy women. They really have not. And now it's showing because, once again, just as the menstrual cycle is a vital sign of female well-being, fertility is a vital sign of female well-being. Through the young years, the fertility years, I am seeing rampant increases in problems. And we can talk about polycystic ovary syndrome, which is the most common endocrine disorder of women, which is bursting at the seams with growth, unfortunately. It's a worldwide epidemic. I'm seeing it. Every country on the planet is dealing with PCOS now. And it's really an endocrine disorder that links metabolic function to reproductive function. So I consider it the poster child for the perfect disease condition that shows exactly how fertility, reproduction, and metabolic health are all one. That if one is bad, the other is bad. How it really all links the whole thing together.
I know that when I started practicing back in 2007, I believe it was, that the diagnosis of PCOS really, doctors had no idea. They're like, your periods are irregular. It was just starting to catch on, whereas now I guess it's really well known. The other thing that I picked up on was just that the stats perhaps being a bit wrong in the US. And when I was researching for the episode in season 1 of The Shift called The Decline of Our Species, Are We on the Way Out? Dramatically named, I know. I was looking at the rates of chronic disease worldwide. So what I found was worldwide, 7 out of 10 people would die of a chronic disease. In Australia, it's 82% or 9 out of 10 are the stats that they use. But in the US, it was 7 out of 10. And it just made me go, there's something wrong there. And I know that we're comparable in Australia, but it just didn't seem right. And I wonder if it's that insurance picture as to why that is the case.
Well, I can tell you about in the cause of death, because they look at death certificates. Now, one of the main causes of death in the elderly is pneumonia. So they'll put down pneumonia and then they'll say, oh, it's an infectious disease. Well, wait a minute. The reason they got pneumonia was because they were immobilized because they fell and broke their hip. That's a very common thing. So they break their hip, they're immobilized, or they have a chronic disease that make like COPD or some other thing. They have heart failure and they can hardly move. So they become very immobile. They're sedentary. And so when they're sedentary, they're not breathing well, they're in pain, they're shallow breathing, and then they get pneumonia. So it completely distorts the reality completely. So I think if I were going to give an estimate, and this is just my own observation, that 90% of death in the US is from chronic disease, and very preventable chronic disease.
It's scary, isn't it? I mean, and I guess I always knew people were sick, but when I did that research, I was like, things are steeply on the increase, and women's health things definitely, but cancer, autoimmune, allergy, life-threatening anaphylactic allergy.
Well, they're saying that life expectancy is going down. And in the US, the newest data, 40% obesity.
Wow.
I know. This just came out like a week ago. 40%.
Tell me what's the net effect of people for that when there's that type of rates of obesity? How will we see that showing up?
Obesity has many causes. We have so many chemicals in our food in the U.S., and it alters our gut microbiome, creating impaired gut barrier function and inflammation. So when you have all this inflammation causes insulin resistance. Once you have insulin resistance, you're having high levels of insulin, which I mentioned. Once you have high levels of insulin, you only make fat. You don't burn fat. You can't multitask. Even women cannot multitask and burn and make fat at the same time. So once you become inflamed, once you have chronic low-level total system-wide inflammation, which is now rampant, because of gut problems. Once you have this inflammation, it's really terrible. It leads down the path to diabetes and prediabetes, or just even chronically elevated insulin. So people have inflammation, it breeds diabetes, insulin resistance, they make fat. Then on top of that, our lifestyles are so altered. We're so sedentary, so we don't burn very many calories. And then one of the things that I think was one of the biggest discoveries of the last couple of decades has been the circadian rhythm. All rhythms, but we'll say the circadian rhythm is really like the highlighted one. And it's not just what you eat, just like it's not having hormones, it's having them in the proper levels and in the proper rhythms. And it's not just what you eat, although that's critically important, it's also when you eat. And so we have a society that tends to skip breakfast. In fact, a new article just came out showing that people who skip breakfast are more likely to have cardiovascular events. So in the US, many people skip breakfast, or they have a sugar dose, which is not helpful either. And then they eat their biggest meal at night. They snack all day long, maintaining high insulin levels. They eat late at night when they're most insulin resistant. So it turns out that people are genetically determined to be certain things. And it turns out we are genetically programmed to be most insulin sensitive in the first half of the day. So what does that mean? It means that when you eat food, your insulin levels and your insulin receptors are programmed to actually function most efficiently. So when you eat food, the glucose that's produced will be more readily transported by lower levels of insulin across cell membranes into the cells. So you don't need to have as much insulin, so that's good. It won't have to be around as long, and the glucose level won't rise as high, and the glucose will get into the cells, which actually need glucose because it's a really important source of energy, so that our bodies can make energy so that we can feel good for the rest of the day and do all the jobs we're supposed to do. But that's not what people are doing. They're skipping and not eating food when we're most designed to receive it, and then they're eating at night and often late at night, and it's completely disrupting all of our systems. And then this new system, which has an incredible interrelationship with estrogen and progesterone, which is called the endocannabinoid system. And this is a system of lipid signaling agents, or they call them lipid mediators. This system becomes very dysregulated, and one of the key ones of this system is called anandamide. It actually promotes appetite, which is good when it's in the morning, but not so good when it's at midnight. So people have a very dysregulated endocannabinoid system, which then causes them to have a very dysregulated appetite system and is associated with fatty liver and metabolic syndrome. So this obesity problem is having so many ramifications. And then now we know that when you have inflammation, which then it's like a snowball, keeps growing. So when you have inflammation, you're more likely to get obese. And when you have obesity, you're going to even grow more inflammation because the obesity includes visceral fat, that fat that's around the belly, around the internal organs, which creates the most inflammatory effect. So the inflammation just keeps growing, and then the obesity keeps growing, and it's really hard to stop it. That's why the obesity epidemic is not easily solved. That's why we have to sort of try to stop it before it grows, right? It's like a cancer. It's hard to stop it. And this creates not only inflammation that is related to, of course, obesity and diabetes, but the inflammation that's associated with this obesity becomes neuroinflammation. So they're more prone to dementia and mood disorders because of inflammation in the brain and in the vascular system. So you're more likely to have vascular problems, develop inflammatory plaque that can rupture and create heart attacks and strokes. So it's like a total body involvement. And a lot of it links to the circadian rhythm dysfunction, to the problems with the food and the gut, leaky gut, and so forth. So it's complex. That's why the conventional medical doctor is really at a loss. They have these people come in their door and they don't even know where to start because they're not trained in medical school to deal with these complex problems. And then for women, when they hit menopause and they lose their estrogen production from their ovaries, for women that have been especially on birth control pills, they're not healthy to begin with, then they really get into major trouble and they can have very high incidence of cardiovascular events. Heart attacks and strokes are the number one killer of women. And of course, women are very worried about things like breast cancer. I'm not saying that breast cancer doesn't count, but many times more women die from a heart attack or a stroke. And we need to really plan for this early on. Just like bone. Bone health doesn't develop when you're 60. You have to build your bones earlier. You have to create a healthy cardiovascular system and then maintain it before you start worrying about it like when you're 55. No, of course you have to start wherever you are, but we want to be proactive and educate women that they have to think about all of these systems from an early age because you're building your future when you're young.
Gut health is central to everything, so it may be good to get some additional support. Many of my listeners have opted to do my 8-week Heal Your Gut program. In this 8-week course, I'll take you through the strategies that I use with my patients in clinic every day to heal the gut and give you the lifelong tools you need to support your gut health. To join us, go to theshiftclinic.com and click on Programs and Courses. Men and women, do they have different disease susceptibility, and what is the result of that?
Actually, I talk all the time about the differences between men and women. If you start with their immune systems, because immune systems, I think, are incredibly fascinating. Like I said, they're involved in all kinds of relationships with the body and communications and so on. Well, men and women have quite different immune systems. It turns out that if you go back to the embryo, so that's really the beginning, women have 2 X chromosomes and men have 1 and a Y. Well, one of the X chromosomes on the woman is supposed to be, we thought, was deactivated like right away, as soon as there was fertilization, because otherwise there was this replication of genes with the 2. Well, it turns out that what happens is they actually coexist, these 2 X chromosomes in the female, during the embryologic days for quite a while. And it seems that during that time, when you have the 2 X chromosomes still working, it actually programs the immune system to be unique and quite different from the male and much more robust. Then, even when one of the X chromosomes is deactivated, it's not completely deactivated, 13 to like 18% of the chromosomes are still active, and most of those are involved with immune function. So women have really different immune systems. They're more active. Women have more B cells. They make more antibodies. They have higher numbers of macrophages, mast cells. They have more immune cells. We have more than men, and we make more antibodies than men. We are just like overstocked with immune function. And that's really important. And if you think, why is that? It's because it's really important for women to survive. And estrogen actually has receptors on every single immune cell, the lymphocytes, the B cells, the macrophages, the neutrophils, the mast cells. Every single immune cell of the body has estrogen receptors. So if you had an epidemic, because after all, if you go back to ancient times, when like 20,000 years ago, infectious disease and trauma, and then infections relating to trauma were huge problems. So, and also food poisoning, because, they just ate stuff. They didn't know how clean it was. So you had to have a really robust immune system to survive the potential of an infection or an epidemic. So if you had an epidemic, say, and it was terrible, and a very high percentage of people died, if you had 10 women survive to every man, guess what? The population can rebuild. But if you had 10 men survive to every woman, you're not going to rebuild that population. So women have always been recognized, even from infancy, better able to survive infections than males. And it's built into our immune systems from birth and during embryological times, and also estrogen also really maintains a healthy immune system. Now, here's the problem. When things go wrong, they go wrong on a bigger scale for women. So women make up 80% of the patients with autoimmune diseases. And it's not an accident. It's because when you have an infection, the immune system goes into action. We now know, and this is a brand new understanding of autoimmune disease. So we are like our invaders. In fact, our invaders are our friends when they're part of our commensals. So we are made up of many microbiomes. So they're actually considered part of us now. The microbiomes are all of these microorganisms that live on us and in us. They consist of bacteria and viruses and fungi. We usually focus on the bacteria, but we know that these other little organisms are also part of our environments. Well, we actually evolved from these. So if you look at our RNA and DNA, it's pretty much identical to the RNA and DNA of viruses and bacteria. So I think of it this way. If a bacteria is a Lego, everybody knows what Legos are. We play with them. Our kids play with them. So we're like fancy Legoland. So we're like bacteria. We have similar RNA and DNA. So every time a person gets an infection, like a viral infection, a bacterial infection, and we make antibodies against the invading bacteria or virus, we're actually also making antibodies against ourselves, our own cells that look like the particular invader. And there's always some similarities with different cell types. But when the infection is over, it's okay. We did a little damage to our own self. It's like we get caught in the crossfire, because of false, identity. It's like similar because we look so much alike. But so an infection should be the way it was in the old days. You got infected with something and it was a fight to the finish. You either lived or you died, and then it was over. Right? Now that's not what's happening. We're getting chronic infections because of impaired gut barrier function. But it doesn't have to be the gut, but that's the most common. Some people think now the vagina could be a source because there's lots of bacteria in the vagina. If you have an impaired barrier of the vagina, you could also have bacteria, we'll say, enter into our body. And then our immune system goes into action just the way it's designed. It's like, look, invader, leaky gut, leaky vagina. We've got to kill that invader. And the problem is that this leak is constant. It's like a chronic, slow leak of bacteria into our system, and our immune system keeps fighting it. And females have this robust immune system. So we make all these antibodies. We're just really fighting up a storm here because we're trying to live, right? Because we're supposed to survive the epidemic. So we're making all these antibodies that cross-react with our own tissue. And these chronic infections can lead to this, what we call autoimmune disease. What we really need to do is rethink it. It's our immune system isn't broken. It isn't doing something wrong. It's doing what it's designed to do. It's just we have these chronic infections now that are really taking over, and our bodies keep making antibodies against the invader, which looks just like us. So depending on what the invader is, and they actually have signs, like lists of this, that shows that certain types of bacteria are associated with certain autoimmune diseases. So they can actually, the one that got the most play was rheumatoid arthritis, that they've actually identified certain types of bacteria that are particularly associated in the gut with that type, especially at the beginning. So what we need to do is recognize the female vulnerability, and then we have to do everything to maintain our borders, to keep our borders strong and healthy so that they don't become impaired, because everywhere we have a border between the outside world and the inner body, we have immune cells lined up. You name anyone, the gut, the lungs, the sinuses, the skin, we have immune cells, like particularly mast cells, the first responders, lined up waiting to kill the attacker. The problem is when you have this chronic infection because of low-grade leakage of bacteria, viruses into our system, the immune system is always on hyper alert. So, and one of the things I just have to mention is that birth control pills alter the gut microbiome in a way that increases the risk of certain autoimmune situations. There's been some data on Hashimoto's and worsening of Crohn's disease and lupus. There's been some association. So we need to be aware that we're altering the gut microbiome and then hence potentially creating the potential for autoimmune disease to set in because of chronic infections. And the same thing happens in menopause. That's why after menopause, rheumatoid arthritis, for example, becomes so much more prevalent. It's about loss of estrogen because estrogen maintains everything. I mean, I love estrogen. I say, you know what? People who are afraid of estrogen, they are afraid of the wrong thing. What they should be afraid of is loss of estrogen, not having estrogen. Estrogen maintains everything in the body. Like I said, it's the link between everything functioning and reproductive function. And it, of course, in the gut, there's receptors for estrogen everywhere in the gut, on the lining cells, the enterocytes, the nervous system, the enteric nervous system of the gut, and so on. And without estrogen, leaky gut will develop, and then you run the risk of developing inflammation and all this stuff that leads downstream from having chronic inflammation and autoimmune diseases.
You're speaking about insulin sensitivity being higher in the morning and lower at night. Tell me what your opinion on intermittent fasting is for women in particular, and particularly for menstruating women.
So we'll make some definitions here. So the first one I'll say is time-restricted eating. So anytime you're not eating, technically you're fasting. So during the 24-hour day, if you don't eat for a certain period of time, for that time, we call it time-restricted eating. So the best thing is, not that everyone's doing it, even myself, it's hard to do this on a regular basis, but the best thing would be to have a big breakfast. I don't know who was so smart to come up with the, eat breakfast like a king and goes down the line, to dinner like a pauper, but, eat a big breakfast and then a medium lunch and an early light dinner. That would be ideal. Or you could have a really big brunch and then have an early light dinner. Then you only have 2 meals a day. It's not calorie restriction. It's not nutrient deficiency. It's just how you time your food. And then you'd want to have a minimum of 13 hours from dinner to breakfast. When people fast through breakfast, they're harming themselves. So we just need to make that super clear. The body was evolved to receive food in the morning. Now, humans are incredibly resilient. So there are plenty of people that live and they don't eat breakfast. But if you want to work the statistics in your favor, then you'll do what's best for you, right? There are plenty of people that do all kinds of things that are not optimal and somehow they live because we are amazing creatures. Homo sapiens did not become extinct for one reason. We're incredible because look, we don't have fur. We're not super fast. Well, we're not that big. How come we didn't become extinct? Because we're like amazingly resilient. But, we push the limits here. So if we want to go with the best odds, we should eat that way. Now, what about fasting? If a woman wants to lose weight, if she's inflamed, this is, with 40% of the population obese, this is going to be typical for women, that they want to get healthier. Even if they want to just be healthier, like for longevity, it's a good idea to go without eating for a certain amount of time, not just during the 24 hours, but actually during the week or the month, depending on, there's different approaches. Now, for a woman who is cycling, you don't want to fast at all. You want to do the time-restricted eating, but you don't want to fast for a day, 2 days, 3 days, 4 days, where you actually don't eat any food for several days in a row during the follicular phase. Now, interestingly enough, the National Institutes of Health in the U.S. seemed to be very interested in this topic in the 1990s. I have no idea how that came to be, but they funded a number of studies on fasting in women during the menstrual cycle in the 1990s. I have searched PubMed for more research. We need more, but there was at least a flurry of research done at that time, and that's what I have to rely on. But when they did the studies, what they found is that if you took a normal weight woman and you fasted her for 2 to 3 days during the mid-follicular phase, so that's the time of the menstrual cycle preceding ovulation. What happened was she would still ovulate, but her spike of estrogen or estradiol spike and her LH spike, which is what triggers ovulation, they were lower. They didn't spike as high. So even though she had an ovulation and she had a period, it wasn't as good. So you would not want to do that. If you did it once and you weren't trying to get pregnant, it wouldn't be a big deal. But in general, you don't really want to lower your estrogen spike because that spike of estrogen is really critical for setting up the receptors for the progesterone and actually stimulates tumor suppressor genes, which actually suppress potential cancer developing, like in breast tissue. And nature took care of everything. But that spike of estrogen is really important. We don't want to lower it. So I would not want to recommend ever doing that kind of fasting where you fast 1, 2, 3, 4 days during the follicular phase. Now, they did studies where they had women do the same, where they went up to 3 days of fasting in the luteal phase. So that's the time between the ovulation and the onset of the period. And what they found was it didn't affect anything for the next cycle. So it was fine. It didn't change anything the next cycle. But what it did for that cycle is that it increased parasympathetic output and lowered sympathetic output. So what that means, it was a calming effect. So there was actually more heart rate coherence, meaning that the heart rate was calmer, that the woman was in a better state. So I think that this is a potential for women who suffer from PMS. And so this is actually the time for fasting for women during the luteal phase. And especially if she has anxiety or isn't sleeping well, this could be really helpful for her because it increased parasympathetic. So parasympathetic is like when you have a baby who's sleeping in a crib and it's that slow belly breathing of a baby and it's so calm and the baby is so happy and just so peaceful. That's what we want for us when we sleep. And so that's what this sort of stimulated. So that's really exciting. Now, in women, by the way, who did fasting 2-3 days in the follicular phase, if they were at all underweight, they didn't ovulate at all. They didn't test overweight women. This was the 1990s. So they didn't test overweight. But normal weight women, they just had a lowered spike of their estrogen and LH, but underweight women, and it wasn't like severe underweight, but a little bit underweight, they stopped ovulating altogether. So it can show you why anorexics, women who have, sadly deal with anorexia nervosa, why they stop ovulating. Because nature says, we're done. You're not going to make a baby. You're not healthy. We don't want you to have a baby if you're fasting. Now, there was some interesting, this is very preliminary data. So it's just something to think about, not that I can say that this is a fact, but there was some data that if primates fasted during reproductive years in this manner, that nature sort of went into this, hey, you can't have a baby now because there's not enough food. So what we're going to do is shut down reproduction now, like for this cycle, but we're going to actually cause preservation of your ovaries so you'll actually reproduce later. So there's the potential that if women, this is just potential, but it's very exciting, if there's some fasting during the reproductive years, it will actually prolong reproductive life.
So tell me about the book, Felice. What is it all about?
So I now have 2 books, I'm so proud to say. They're both on PCOS. The first one is my foundation book. It's PCOS SOS, a gynecologist's lifeline to naturally restore your hormones, rhythms, and happiness. And it's a 7-step book that tells you how with a woman with PCOS can really regain her health and therefore her happiness. So it's all lifestyle based. And I include all the different supplements and how to take them and even companies you can buy them from. So it's really looking at getting a woman's rhythms in place. We now understand, and this is a really new understanding of PCOS. Women with PCOS have the whole array of metabolic dysfunctions. They tend towards having inflammation because now it's been shown, the first study came out of China that showed that women with PCOS have gut dysbiosis. They have abnormal microbiomes of their gut, and that leads to leaky gut. And once you have leaky gut, you end up getting the immune system sort of activated and you get release of inflammatory cytokines. This was shown in 1998 by a researcher out of Indiana University that women with PCOS have immune cells that have a lower threshold to release inflammatory particles, what we call inflammatory cytokines. Now, in 1998, they had no idea why that was. It was just a finding. Now we understand all immune cells contain estrogen receptors. In the absence of estrogen, the immune cells are not well controlled, and they're more likely to respond to an inflammatory stimulus like the endotoxins that come through the gut wall when you have leaky gut. And these endotoxins, also known as lipopolysaccharides, trigger the release of inflammation particles, inflammatory cytokines from immune cells like mast cells. Well, the immune cells in women with PCOS, because they don't have enough estrogen, have a lower threshold. So they're more prone to releasing their inflammatory contents, creating an explosion of inflammation. So you have the perfect setup for problems. You have gut dysbiosis, leaky gut, immune cells that are like trigger happy and release their inflammatory contents. And then this inflammatory process, what does it do? It increases insulin resistance. Insulin resistance promotes more testosterone production. And then the testosterone goes down the assembly line into the granulosa cells, where through the enzyme, it's called aromatase, gets converted into estradiol. Well, in order for the enzyme aromatase to work properly, you need to have proper amounts of FSH, follicle stimulating hormone. It's now been shown that women with PCOS do not make enough FSH. Their enzyme aromatase isn't working properly. So they have like a block in their assembly line. They have plenty of testosterone, but they can't convert it properly to estradiol. So the brain says, hey, I want more estradiol. So it puts out more LH, luteinizing hormone, which triggers the production of testosterone. So you have more and more testosterone being produced, but you don't turn it into estradiol properly. So you have this excessive amount of testosterone, a deficiency of estradiol, and then when you have this inflammation in the high high levels of insulin, that triggers the production of IGF-1, insulin like growth factor 1, which triggers the ovaries to make even more testosterone. So, this is like terrible. So you have all this inflammation, all this testosterone, and then you get all of the manifestations of hyperandrogenism, where a woman with PCOS gets facial hair and loss of hair and cystic acne, which is so challenging to treat. It's recalcitrant to all the standard treatments. That's what they call it, hormonal acne. And all this inflammation and creates more visceral obesity. And estrogen is involved in mitochondrial function. Those are the little structures in the cells that burn fat. So women with PCOS are very good at making fat, but they're very poor at burning fat. So they tend to accumulate fat. Even thin women with PCOS, which make up the minority, like 20% or less, if you did actually a CAT scan on them, they've done this in studies, even what they call lean women with PCOS tend to have more visceral fat or belly fat compared to other women at the same weight. So all of this needs to be controlled. Estrogen also regulates the master clock in the brain. It turns out that there's some data that women with PCOS live with the equivalent of a life of jet lag. So there's a lot of data on jet lag. Women who work the night shift, for example, like nurses in a hospital, they have much higher rates of obesity, depression, sleep problems, diabetes, and so forth. So the same problems that women with PCOS are dealing with. Women with PCOS have an upregulated sympathetic nervous system. They tend to be more producers of cortisol. They have a lower stress response. Just like they're more prone to a lower threshold of inflammation triggering, they're also at a lower threshold for stress stimulating. So it takes less to produce more cortisol for them. And cortisol then in turn creates more inflammation long-term, more gut leakiness, and more insulin resistance. So you can see it's everything snowballs together. So all of these facets are approached. And I have used this with my own patient population for quite some time with really dramatic results. For some women, I say, it may take a year to really get where you want to be altogether, but in most of my patients, after about 6 months, they're already cycling again. Almost all of my patients will cycle, not 100%, but most of them will. And it's so rewarding to see the weight come off, the cycles come back. Then my newest book, which is PCOS SOS Fertility Fast Track. So it's for women who really want to get pregnant with PCOS, and it's the most common cause of infertility in the US, probably in the world, but it's a huge problem for fertility. And women with PCOS often end up at the IVF centers, and they have the lowest success rate for IVF. They have very high rates of miscarriages and pregnancy complications, every kind that you can think of, preterm labor and gestational diabetes and preeclampsia, and even malpositioned babies and abnormal labors, every problem that you can think of, they have higher rates of. So even women, the few percent that don't start cycling regularly, if they do end up going into IVF or using fertility drugs, they're more likely to have a successful, uncomplicated pregnancy and a healthy baby, because we really want to get women healthy before they conceive. So my fast track book is a 12-week, step-by-step, week by week. What do you buy? It has here's your shopping list, everything you do. So it spells it out. This is what you do for 12 weeks. Say you're in a rush, just give me 12 weeks, and I will optimize your chance of getting pregnant. And even if you need fertility drugs after just 12 weeks, your chances of having a success with the fertility treatment and a healthy pregnancy is significantly increased.
Have you listened to Season 1 of The Shift? If you're enjoying this conversation, you'll love Season 1, where we deep dive into the field of gut health with 24 of the world leaders in this area. Once you're done, head back to your podcast app and find episode 1. It's a great place to start. Why do you think PCOS is so steeply on the rise?
Well, it's the perfect storm. It starts in utero. So we now have data predominantly on BPA, bisphenol A. So BPA comes in a variety of sources. It's from a petroleum product. It's found in different kinds of plastics. So every single person, because of all the plastic in our lives, every single person has BPA in their body, or close to 100%. The problem is in utero, they said, but the levels in the woman, the pregnant woman, they're really low. Well, it turns out that they were measuring it incorrectly. There's new articles that showed that the scale and the whole technique that they were using to measure it was wrong. But even with that, what they also found is that it concentrates in the fetus. So BPA is a known xenoestrogen. It works on the estrogen receptors, but it's not estrogen, it's plastic. And in utero, remember I mentioned that you only get one chance to make your receptor system for your hormones. It's in utero during the fetal time. So if you have BPA in the mix, what happens is the receptors are not made properly. So this has now been shown in studies that women with PCOS have abnormal receptor function, reduced receptor function for both the estrogen receptor alpha and beta. Those are the two main predominantly nuclear receptors. Both of them are lowered receptivity. So remember I mentioned that a receptor is like a mouth. It can be open or it could be partially open or it could be closed. So in women with PCOS, their estrogen receptors are more closed than open. So this is like a double whammy. They make less estrogen, and the estrogen receptors are less open, they're less receptive. So women with PCOS are actually living a life of estrogen deficiency. They now have shown that you can identify kids that are like 7 years old who have a high chance of developing PCOS by measuring a certain hormone called adiponectin. This is a hormone made by the adipose tissue, which is the fat tissue. So fat, it turns out, is an endocrine organ. I didn't mention that before. So fat makes all kinds of hormones like leptin and adiponectin, makes others as well. So it's very metabolically active and it's hormonally active tissue. So it turns out that adiponectin is a hormone made by fat tissue that promotes fat burning. So you can find low levels, because you want high levels help you to burn fat, and they find abnormally low levels of adiponectin in the blood of girls at age 7 who are prone to developing PCOS. They've also shown that girls who develop PCOS when they're children tend to they never get rid of their baby fat. They have like little pudgy bellies. They just, even though they eat no differently than their friends, they just carry more body fat, even at a young age. So that's like the beginning. Then you add to that the problems with the food, the chemicals in the food, the lack of nutrients like magnesium, which is so key to glucose transport and proper function of glucose and so on in the body. So we have all of these deficiencies. Now, even in children, they make estrogen, but they don't make it from ovaries because they're children. Even the girl children, they make it in organs. So it's called paracrine. So different organs in the body, many organs in the body can make estrogen on their own, like the brain, the gut makes estrogen, for example. But the problem is, even if they could make it well, what are they going to do if the receptors aren't working properly? So little girls are already at a disadvantage in childhood. And then what typically happens is when they go through puberty, because of the abnormal ovarian function, they have like an explosion of testosterone and abnormal cycles. And because of the high levels of cortisol that happen at puberty, they start putting on a ton of weight. And then that just increases inflammation. And like we talked about, it's all downhill from there. So it's poor choices, chemicals in food and water. And then you add on that circadian rhythm dysfunction. So all of these things come into play, and you can see how there's an explosion of PCOS in the world.
What about endometriosis? What have you seen with the increases in endo over the years, and what do you think the driving factors behind that are?
So endometriosis is a complex condition that has some similarities and differences. It's interesting that actually women with PCOS have higher rates of endometriosis than the general population. And it stems from a combination of genetic propensity, but now they've linked endometriosis to certain pesticides like dioxins. And these pesticides, when you're exposed in utero, that's a very critical time of life, alter the progesterone receptors. So they found that women with endometriosis have malfunctioning of their progesterone receptors. We talked about with PCOS, it's estrogen, primarily estrogen receptors, but there may also be other receptors, right? So that's why you can have more than one thing in one person. So it could be melatonin, it can be progesterone, but the dominant one in PCOS is estrogen receptor malfunction. In endometriosis, it's progesterone receptor malfunction. When you have a menstrual cycle, the lining has to shed out in its entirety. Well, some of that goes backwards through the tubes. We call that retrograde menstruation. We used to think that that was unique to women with endometriosis. It turns out it's not. It's universal. All women who have a period will have some, I call it like backwash, this retrograde tissue that goes out the fallopian tubes, and it goes into the abdominal or peritoneal cavity. Now, this tissue is dead. It's inflamed. It's infiltrated with white blood cells, the inflammatory cells, because the process of sloughing the lining is inflammatory. And at the time that you have your menstrual period, the estrogen is the lowest that it is in the entire cycle. So it's the time of the menstrual cycle when it's the most inflammatory. When you have high levels of estrogen, like at ovulation, that's the most anti-inflammatory. So estrogen modulates inflammation and it controls it. So nature took care of everything when everything is going right. So when you have the spike of estrogen that precedes ovulation, that's very anti-inflammatory. So inflammation is suppressed, which makes sense because you have sperm coming in, presumably, right? So that you get pregnant because you're ovulating. And you don't want your immune cells to attack and kill the sperm. So you don't want to have a really high level of inflammation. But when you're getting rid of the lining of the uterus, that is a sloughing and dying, and so it's an inflammatory state. And at the same time, this dead, yucky tissue is actually coming out your tubes. Well, that, if you don't have the proper controls, will create an inflammatory response in the pelvis. Because remember, your immune cells line every interface, and there are immune cells in the pelvic cavity, like mast cells, waiting for some bad thing to come through the tubes, like a sexually transmitted infection, so that it will attack it, right? Because it wants to protect us. So the immune system sees this stuff coming out the tubes, and it's like, whoa, what is this? And it activates the mast cells, which have receptors called toll-like receptors for everything. Mast cells will react to everything and anything that tries to get into our body. They're the first responders. So the mast cells see this dead stuff coming in. It's all inflamed, and they explode. So some people call endometriosis a variant of mast cell activation because all these mast cells are exploding because all this stuff is coming in. And then the mast cells call in the troops. They have what they're called chemokines, and they call in all the other inflammatory cells, and they create this huge inflammatory reaction. And all of this inflammation is going on. And estrogen is made in the pelvis. It's made in many sites. So estrogen is made in the pelvis to modulate inflammation. And it helps control these enzymes that are produced by white cells called matrix metalloproteinases. And estrogen is about healing and nurturing. So when you have inflammation, it triggers the enzyme aromatase and you make more estrogen. So inflammation triggers the production of estrogen. So now you have this whole inflammatory process going on in the pelvis. So now you're suddenly making all this estrogen, which you shouldn't normally be making all this estrogen. So estrogen is about nurturing and proliferation and growth. So like if you get a big laceration on your arm, on your skin, estrogen is what modulates the healing process. It regulates the platelets, the growth factors, the creation of new blood vessels, what we call angiogenesis. So estrogen is about growth and proliferation and healing. But estrogen wasn't supposed to be in large quantities in the pelvis during retrograde menstruation. What I'm describing is when things go wrong. So now you have all this estrogen being produced, and estrogen doesn't know what endometriosis is. Estrogen isn't used to seeing all this endometrial tissue. So estrogen does what it's designed to do. It tries to heal and nurture. So instead of killing these endometrial cells that are some of the cells that come back through the tube, the retrograde menstruation, are living cells. So it doesn't know what it's doing. It thinks it's helping you. So it nurtures those endometrial cells and it helps them to grow and create new blood vessels. That's the implantation of endometriosis. So the immune cells are not properly controlled, and the body wasn't designed for estrogen to be produced in large quantity in the pelvic cavity when you have a menstrual cycle and you have the period blood coming back through the tubes with the endometrial cells. So what is supposed to happen. This is what happens in a woman with endometriosis. So every time she has a menstrual cycle, she gets this crazy inflammatory response in her pelvis, and she gets all the lining cells coming in, and then she has this extreme abundance of production of estrogen locally in response to the inflammatory response, and the estrogen being designed to nurture and grow and cause new blood vessels and stuff, it's actually contributing to the production of endometrial implantation and supporting the endometrial tissue that's growing abnormally in the pelvis. But nature had a plan for all of this. It turns out that when you have the spike of progesterone, the progesterone receptors that exist in the pelvis involving the immune cells actually control the immune cells and calms them down. They're malfunctioning because of exposure to these pesticides in utero. We don't know how to fix it. But if we know that what's supposed to happen is the endocannabinoid receptors are supposed to be activated, maybe we can skip the progesterone part and go straight to the endocannabinoid receptors and use a phony endocannabinoid to actually get things going and talk to the mast cells and say, mast cells, calm down. And there's actually some data just coming out now that this is something beneficial. So it's not fixing the underlying problem, which we always would rather do. But like with PCOS, I don't know how to recreate new receptors, but I have workarounds. And so I call this another workaround for women with endometriosis. And I think that it's really something exciting that we've discovered the role of the endocannabinoid system on the immune cells, like mast cells, and the role that it plays in endometriosis as a new way of treating women with endometriosis. And if we are thinking early, like I just had a patient this week who's in her early teens and has had periods for just 3 years, and she has horrendous periods. I don't know if she has endometriosis. I'm not doing surgery on her, but I can give her some, which I did, some CBD suppositories to use and then see how that does for her, because what I want to do is be proactive, not just reactive, because there's nothing I can do for someone who has advanced stage 4 endometriosis, where everything is adheres to everything. She has big endometriomas. I mean, I can help, but I can't bring her back to a state of pristine, normal pelvic anatomy. I don't have that power. So we have to be really proactive and think about endometriosis in every young woman who has horrendous menstrual cramps or she has pain with intercourse. We have to do really good pelvic exams, get ultrasounds. If there's any question of endometriosis, we don't have to rush everyone into the operating room, because studies have shown that doing surgery actually doesn't change the long-term outlook for these women. But of course, it can do harm too. We're putting them through surgery and we can create adhesions and so on just from our manipulation of things. So we want to try to calm down the immune cells. Understanding endometriosis as an overactive immune response to retrograde menstruation is really key. And then working to calm that immune system through whatever methods that we can. I'm thinking of everything that we have, mast cell stabilizers, like quercetin and so on. I'm using them all. Everything that I have in my armamentarium, every therapeutic tool to calm down those mast cells. If those mast cells don't explode, and they don't call in all the troops, then you don't have that inflammatory response. You won't get that excessive production of estrogen, which then goes into the supporting of the production of endometrial implants. The solution cannot be what conventional medicine is proposing. You shut down all the hormones of the woman so that they don't have menstrual cycles. Well, it's basically chemical castration. We know women need hormones. The solution to having termites in your house isn't to blow up your house. That's really what we're doing with women with endometriosis. We know that they're having hormonal issues, so we blow up their hormones so they don't have any. That is a terrible solution, because we know you need hormones for so many functions in the body, not just reproduction. So we're now at least understanding so much more about endometriosis so that we can have much better approaches. And I'm really excited for the future, what may be in store for understanding and then treating endometriosis in a much more sane and effective way.
What do you think the biggest issue that women face with their health these days?
I think the biggest threat is maintaining a balance of everything that's happening. Women are not getting enough sleep and exercise. They're trying to do too much. They cannot balance everything. There's only so many hours in the day, and they just keep trying to add more things on. So by adding more things on, they're leaving out things that are critical to their health, like time for just self-awareness, meditation time, for taking a walk outside and just looking at the leaves and the grass and the clouds, and maybe having a soaking bath, and maybe having time to talk to the significant people in their lives. They don't have time for things that really matter because they're always busy doing something. This is going to take a huge toll on their health. So without having enough time for the really critical things in life that really give meaning to life, and bringing people together, and running around like, the old saying, like a chicken with the head cut off, they're just trying to do too much, and the stress level is through the roof. I think the biggest threat is our modern society that's putting too much on women. And women have to just say, okay, I have to prioritize. And that means cutting stuff out. And you just have to learn how to say no, and then have to say yes to yourself and your personal needs.
Thank you so much for your time.
My pleasure.
There was so much amazing information in this episode. Let's review some of the key points and what action you can take as a result of them. We're seeing changes in women's reproductive health across all ages. We're seeing earlier puberty in young girls, more PCOS, endometriosis, and fertility issues for those in their reproductive years, and more problems during menopause too. This is because the underlying causes are the same: chronic stress for women like never before, exposure to more and more endocrine disrupting chemicals, poor microbiome health, and nutritional deficiencies. Many of these causative factors also contribute to weight gain and excessive weight, which can lead to inflammation and insulin resistance, also big issues when it comes to hormonal health. We're up against a lot of factors, which is why so many women are struggling right now. Of course, we talk about this in Season 2 of The Shift in a lot of detail. Women have a very different immune system to men, which is why we're prone to a lot more inflammatory and autoimmune diseases. We therefore can't just translate research done on men and expect to get the same result. We need to respect the interplay of hormones and our immune system, and this really shows us the concept of synergism, which I speak a lot about on Season 2 of The Shift. Learning is great, but action is better. Here are a few things that you could do as a result of this conversation in order to help you shift your health and your life. We need to eliminate endocrine disrupting chemicals from our life. This includes not using plastics for food and drinks, staying away from canned food, and using personal care products without synthetic fragrances which contain phthalates. More on this on episode 8 of season 2, which is called Chemicals Are to Blame for Many Hormone Issues We See Today. If you want to have good reproductive health, you have to have good nutrition and the right amount of calories. If this isn't met, our fertility will suffer, and this will show up as issues with your menstrual cycle. So, if you want to fix your periods or have a better menopausal period, make sure that you look at your diet first. I think the last piece of advice here is to recognise that while there is so much complexity, there are people out there that can help you to decode what is going on for you. We do this every day at the Shift Clinic, and there are so many integrative and functional practitioners like Dr. Gersh out there, so make sure that you get the support that you need. Thank you so much, Dr. Felice Gersh, for joining us on The Shift once again. If you like this episode, please let us know by sharing on social media and tagging Dr. Felice Gersh and myself, Catherine Maslin, or The Shift Clinic, so that we can hear what you have to say. Or you can leave a comment on Spotify or a review on Apple Podcasts. You can find out more about Dr. Felice Gersh at Integrative MGI. That's INTEGRATIVEMGI.com, or follow her on Instagram at Dr. Felice Gersh. In our next expert series on The Shift, we have the juicy Kim Anami, a holistic sex and relationship coach with a big message for all of us women out there when it comes to our sexual well-being. Make sure you tune in.
Coming up on The Shift.
And so I realized that I had to really get to the root cause of why people weren't having sex and then show them what's really possible. I would say 10% of the pleasure that a woman has available to her is in the clitoris, and 90% of it is in the vagina. Your vagina and your orgasms are a barometer. If your vagina is not wet, let's ask why. Does sex leave you feeling rejuvenated, ecstatic, transformed, and like it changed your life? And if not, then you're doing it wrong.
This series is a production of The Shift Clinic. Hosted by Catherine Maslin. Music and sound design by Shade Furlong. Thank you to all of our experts. For more details on them, go to theshiftclinic.com.
We can be. We must be.
The first generation to end extreme poverty.
The generation most determined to fight injustice
and inequality.
The generation that saves the planet
from climate change.
And this is how we will get it done.
The global goals.
A 15-year plan for everyone, everywhere.
With no one left behind.
The global goals are a framework that collectively help us
support the health of our people
and the planet.
At Shift, we are ambassadors for the global goals.
This project supports global goal number 6.
Clean water and sanitation.
Every time you listen
to an episode of The Shift,
we provide a day's access to clean water
for a human in need
in Malawi, Africa.
Water is the foundation to health, and we believe
every human should have access
to clean, healthy water.
So please share this podcast wide
and keep tuning in
so we can impact those who need it the most.